Welcome back, everyone, to another episode of The Wellness of Madness. I am your host, Lorraine, and I am a behavior change specialist, a health coach, a personal trainer, a yoga teacher, and a nutritionist. And my diagnosis is Tourette syndrome, obsessive compulsive disorder, borderline personality disorder, and generalized anxiety. So before we get started with today's episode, I just want to give a little disclaimer. This is not medical advice. This podcast is just a space, a free space that we share our stories and our trials and tribulations with different mental disorders and illnesses. However, if any of this resonates to you in any way, please reach out to your medical facility or your primary physician. They are there to help you. We will sometimes discuss stories that have to do with medications or hospital visits, but again, this is not medical advice. But we're here to share with you our stories, and hopefully you will feel safe and you will feel maybe some stories make sense to you, and that's what we're here for. So on today's episode, we are talking about borderline personality disorder. Now on season 1, this was the most downloaded episode, and I was shocked. I'm very glad it was, because it means that people want to know about this, and perhaps they feel that they may be dealing with BPD. So I can't wait for this episode to begin, because I have a very special guest here today. Our special guest is Xannie Stavert, and she is a seamstress, a BPD advocate, and a psychology student. So let's bring her right in and let's get this show started.
Hey.
Hi, Xannie. Welcome. Thank you so much for joining us in the Wellness of Madness. How are you doing?
I'm doing pretty good. How are you?
Good. I must say I'm very excited, because you are actually the first person I've ever spoken with BPD. So
that's awesome.
Hey, it's a club.
Yes.
So Xannie, why don't you tell us a little bit more about you? I'm really interested in the seamstress part. You're a wonderful BPD advocate. So give us a little bit of your life story.
Well, I've been sewing for pretty much as long as I can remember. I think when I was 4, my mom sewed, and she had like a big needle and put some thread on it, and I just like stuck it in and out of a piece of fabric, and it didn't really become anything. I guess it was like a loofah. But I've been sewing ever since, and it's one of the things that really got me through many years of depressive episodes. People will say things like, "Oh, you're so good." And I'm like, "Yeah, it's because I spent 8 hours a day locked in my apartment, just like sewing for hours." So, pros and cons. A couple years ago, I turned that into a job. And yeah, so now I do it part-time because I'm also a student, but yeah, so now I make things for a living.
Wow, you work as a seamstress. That is unbelievable. I love it, because I don't feel like we have enough seamstresses. And if anyone out there listening, which I do have a particular friend, she loves to sew. And she's like, "Oh, but I don't know if I can make anything out of it." And I was like, "Yes, you can. Yeah, absolutely you can." So I'm so glad you're doing it. And part-time, you're a psychology student. Tell us a little bit about that.
Yeah, so I am full-time school, part-time work, and I'm I guess almost done with my psychology credits. I decided that one of the things that's really important to me was to reduce the suicide rate of patients with BPD by at least 1% in my lifetime. And unfortunately, that's not really a job title. And so that meant that I have to go to school to try to figure out what that is going to entail, all the parts that lead up to actually completing an attempt, and try to figure out ways to circumvent that will be effective in the long run.
Well, that is certainly just wonderful. I mean, I know what it's like to go through the education trail, and it's not easy. There's a lot of things that you have to do, and there's a lot of classes, and it's a grind. So thank you so much, because we do need more people advocating, and also people trying to help, trying to remove the stigma for mental health. So tell me a little bit about your diagnosis with BPD.
Well, I was officially diagnosed in 2009, but the first time it was ever suggested, I only found out about this recently, actually, it was first suggested to my parents in 2004. But in 2004, I was 15, And, at this point, that's like 18 years ago. And guess how old I am. And back then, I mean, it's still pretty taboo now, but back then it was especially taboo to diagnose a teenager. And it came up because I had an eating disorder. And one of the nutritionists suggested to my parents that it might be something I was doing to manage my emotions, but they didn't really know what it was. And again, sort of taboo for a teenager to get the diagnosis. So it wasn't until things kind of exploded after an on again, off again relationship and many attempts to end my own life that I got an official diagnosis and started a very long and arduous process of recovery.
It's interesting that you mentioned that it took so long. I know that when I was in the United States, they were very hesitant to diagnose me when I had some issues when I was 13. And when I was 16 in Mexico, I was diagnosed with borderline personality. But again, a lot of taboo people are like, she's psychotic, she's insane, just completely uneducated. So we're talking that at 15, you were already feeling some of those symptoms. And then fast forward 18 years later, you get diagnosed.
No, 18 years till now.
18 years till now.
It was 2009 when I was diagnosed. So that was another 2004, 5 years.
So another 5 years in between you actually getting your diagnosis. Were you diagnosed with anything else at that time or before?
Yeah. So bulimia. And I mean, it was kind of eating disorder, not otherwise specified, because I kind of went through a lot of different behaviors, but bulimia is the most prominent one. And in high school, I was diagnosed with ADHD, which was one of those things that no one was really sure if that was really going on or not. And in more recent years, it seems now that there's more research and more information out there about, especially about adult ADHD, it does seem like that's actually something that I deal with. But at the time, it was one of those like, me and my family both were, it's kind of hard to take therapists and psychologists seriously sometimes when there's an overemphasis on a certain narrative. And if that narrative doesn't fit with your life story, then it's hard. It's like, I don't know if what you're saying is true, because you're also making all these assumptions about how you think my life must have gone to get here, and those things don't align.
Yep. Sometimes those labels that they try really hard to put on, it's not relevant to you. So you're like, well, it can't be this. That's very true. So let's dive in to borderline personality disorder. And I'm going to talk a little bit more about what it is later on, but I want to know from your perspective and your story, when was your BPD at its worst?
So it was definitely right before I was diagnosed. In 2009, I was in an on-again, off-again relationship. And it became one of those things where, I don't think either of us were terrible people in the beginning, or just like in general, but it wasn't a good fit. And every time we were in an off again phase, I would feel worse and worse. And every time we broke up, I felt this really strong need to act out to try to get that relationship back. And it ended up being that I would try to kill myself every time. And I had a family member who, as a result of that, I ran into them when I was out. It was like a week after one of my attempts, and wanted to engage with this person. And they were like, I can't deal with this. And at the time I felt really rejected and horrified and angry. Like, don't you know how much I was suffering? And now that I look back at that time in my life, I really realized that BPD is not just something that affects the person who has it. It affects everyone in their circle. And that just because my family members don't have it too doesn't mean that they don't have feelings. And I realized how upset this person really was and how traumatized they were, because at this point it was like 3 or 4 attempts. And for them, it was extremely emotional and exhausting to watch me go through this over and over and over and over again. And eventually they were like, I love you, and I can't Like, I can't think of something to do to help you. And it hurts me too much to watch you do this to yourself. And that was really hard, because it's like, how do you blame someone else for that? At the same time, it's incredibly hurtful when they're not able to stay there.
Absolutely. I totally understand that. I think that many times in my personal life, it was very much like that. And it's funny that you mentioned a relationship, because when it all started for me, it was a relationship as well. And there's that disconnection. I always thought, like, why can't people be empathetic towards me? Why can't they see how much I hurt and I'm still there for them no matter what? But same thing that you're mentioning, they're going through it with you as well. There was so many times where I call them episodes, sometimes I call them fits, where, I'm yelling at this person for an hour and I'm throwing things at them and I'm saying horrible things and I'm just gonna hurt myself. And then I'm sad because they don't stay. And now I think back and I'm like, oh man, I was putting them through hell and back. And I'm just grateful that they even stood as long as they could. But tell me a little bit more about those feelings, because in the past I've heard many labels. People have said that I was toxic. People have said that I was dramatic. And I don't like those words, because I don't believe anybody is toxic. What do you think about the word toxic?
I am glad that you also don't like it. I don't like it for a lot of reasons. I don't like it when I get labeled that way, and I don't like labeling other things that way, because to me, the word toxic, I think of poison. I think of substances that if you're exposed to them, unless you take an antidote, there's literally nothing you can do about it. And I think when we give those labels to people, it makes me at least think that it's a powerless situation, because, if I'm poisoned, there's nothing I can do about it. If somebody else is poisoned, like, unless I have an actual substance that can save their life, there's no action I can take, no mindset I can have. And so I don't like that, because I've actually been a victim of things in my life, and I don't want to put myself or other people in a box and say, you're toxic, I'm toxic, that's just the way it is, so deal with it. And because to me, it's like, I believe that I can change. I believe that other people can change. If I'm not behaving well or other people are not behaving well, it doesn't mean that either one of us should be expected to put up with problematic behavior. But I also don't think we should go around talking about ourselves or others as if they are irredeemable or incapable of change, because in most cases, I think we do have the power to be different if we are brave enough to take it.
I love it. Very well said. Absolutely. Because especially when you're a teenager, teenagers don't really understand that concept, right? So at least for me, it was, well, you're telling me that I'm toxic and you're telling me that I'm poisonous, then I'm going to be exactly that. You know what I mean? You already expect me to be crazy. I'm going to act crazy. I'm going to freak out in the street, and I'm going to, and it just became a part of who I was. And I almost enjoyed it. But really, I was very sad. I was very depressed, and in my own comfort, I was cutting and I was doing other, self-harming things. And that's one of the biggest things when I went into behavior change, was because I wanted to teach the world that people can change. And it starts with positive affirmations, and it starts with understanding that change is possible. So you mentioned your experience with that relationship. How were your experiences with friendships and relationships during the hard times with BPD?
So I guess I should say I experienced all the symptoms. I was diagnosed with severe BPD, so pretty much everything that is part of the diagnostic criteria is part of my experience. And I think the very black or white perception of others was probably one of the biggest issues. And in the very worst parts of my BPD, it was very, like, from moment to moment, it was either things were amazing or absolutely horrible. And I with that one very tumultuous relationship, I, for some reason, started to believe that I could not survive without it. It became like a drug, and very much like an actual drug addiction. It's hard to say at what point, if you even actually really want to be there, or you've kind of become a slave to your own psychology, where you've created this path in your brain that's just like, I need this, I need this, I need this. And you don't even, when you stop to think about it, it's like, I had my dad ask me once, he's like, why do you keep going back to this relationship? Like, everything you ever say about it is not positive. So I don't understand why you keep doing this. And at the time, I think I gave some kind of excuse like, oh, it's not always negative. But now I look at that, and I'm like, I don't know. I probably should have walked away.
It's hard though, because just like you said, it becomes a drug. I didn't really have an issue with substance abuse, but my substance abuse was people. So I was in a relationship where I had created and I had idolized this person to a point where I almost wanted to be that person more than be with that person. I was obsessed, and everything he said was the key. Everything he said was absolutely true. Anything else was nothing, And same thing, the experience was actually quite negative, and it lasted over 10 years of going back and forth, which is maddening now that I think about it. But I was very obsessed with people. And because of that, I became a very good chameleon. I would adapt to people's personalities right away, because I knew that if I did that, they would like me, and I would know everything about them, and I would find out absolutely everything. And it wasn't me not being myself, or at least I didn't think so. It was mimicking them so that they would accept me and trust me. Did you have the similar experience with that?
Yes, although I think for me it was a little bit different, but I definitely struggled with identity. For me, it came much more from a place of not wanting to be trapped. I have an extreme fear of abandonment, but I tend to think about it in terms of loss, because I didn't really have any dysfunctional relationships like with my parents or sibling when I was growing up. And for me, it was more of, when I came face to face with death a couple times with other people, it became very clear that there comes a point at which, whether somebody wants to or not, they're going to disappear. And I rejected that flat out. And so for me, when I became a teenager, I think part of my getting BPD came from, there's a stage in adolescence where you start to try to find your own identity. And I did not want to have one, because if I had an identity, then I was sort of locking myself into a future. And if I was locking myself into a future, I was committing to living out a life in which I'm going to have to experience all this loss. And so I would sort of become whatever was around me so that I could be liked and not experience abandonment. But there were more layers to that. It was a lot of avoidance of time in a lot of ways. For me, it was like, I'm not going to do anything that forces me to accept that time is moving forward. So anytime I've reached a milestone in my life, like I got married last year, which is awesome. But I also, like the months leading up, there was a big part of me that was like, if I'm married, then I've knocked that off my list. And then there are fewer things for me to do in the future. And it's like, well, yeah, that's life.
It's so crazy to hear someone say this, and it makes me really emotional, actually, because it's that disassociation that I had as well. I didn't want to, is a little bit different as well. I didn't want to be in a relationship because I knew I would lose that person. I didn't want to have children because I knew that possibility of losing a child and just coming to grips with death very early on. Same thing. I had a good relationship with my parents, wonderful family, but I didn't experience loss in my family, but actually witnessing loss in history. I was very into history, and I was very into politics and seeing how the world was and people suffering. I think that's what began a lot of my BPD. And I did the same thing. I didn't want to get married. I didn't want to do these things. And I think in my BPD, there's a high level of narcissism. So my goal at an early age was become immortal, become a legend, do what you have to do so you're never forgotten. But that's it. What you do in the middle, I didn't really care. I didn't care about relationships, and I just cared about getting to that point. So before we keep going, I want to talk to people a little bit about borderline personality disorder, BPD. It's also known as emotionally unstable personality disorder, EUPD, or emotional dysregulation disorder, EDD. So I do believe that borderline personality disorder is kind of an old term that we should probably start moving on from. But again, that is the term that we use. I want to make clear that it is a personality disorder. It is not a mood disorder. So oftentimes people tend to say, oh, it's bipolar disorder. And it's very different. Bipolar disorder is a mood disorder. And one of the general things that you can see is that with bipolar disorder, you might have stages of manic that may last a couple weeks. But with borderline personality disorder, our moods can fluctuate within a day, within an hour, within minutes. You can go from high to low and back down again. People with BPD tend to be extremely sensitive. And again, not to label everyone because everyone has a different experience with BPD. Some describe it as having an exposed nerve ending almost. Small things can definitely trigger very intense reactions. And once upset, we have quite a hard time calming ourselves down. It is easy to understand how emotional volatility and inability to self-soothe leads to really dysfunctional relationships, which tends to be an issue in BPD. I want to reference you guys back to my season 1. You guys can find episode 4, borderline personality disorder. And I actually go through the 9 traits of borderline personality disorder. And we talk more in depth about the whole thing. So definitely go check that out. Another thing I wanted to mention today was stigma. Stigma is when someone or even yourself views a person in a negative way just because they have a mental health condition. Some people describe stigma as a feeling of shame or judgment from someone else. Stigma can even come from an internal place, confusing feeling bad with being bad. And stigma is something that I really want to focus on today because at the end of the episode, I will reference you guys to another page to take the stigma quiz and maybe even take the pledge to be stigma-free. All right, Xannie. So do you believe that there is a stigma on BPD?
Oh, absolutely. I think there are BPD is in a cluster of personality disorders called cluster B. There's 10, I think, personality disorders currently in the DSM, and the others, cluster B in general, is highly stigmatized. And I think because a lot of the behaviors are big, or they can be very big and very shocking. And the stigma gets less severe all the time, I will say, especially for BPD. When I was first diagnosed in 2009, there were only a handful of journal articles about it, and there were a lot of hospitals that did not even want to deal with me. And that's like 12 years since then, it's gotten a lot better. There's thousands of articles about BPD now. There are a lot of programs out there that will take people. But that being said, there's still a long way to go. There's a lot of misinformation out there. You know, the great thing about the internet is that there is a lot of information freely available. The downside is that not all of it is positive or accurate.
Very true. So when you were saying, it wasn't, especially in 2009, some hospitals were like, oh, I don't know how to deal with this. So in my case, I went through about 2 months of therapy, pretty severe therapy. I was given Haldol, which is an antipsychotic. I was given Klonopin, and I was given Prozac. Do you have any experience with medication therapy, and how did you go about it? And did it work out? Did you end up changing that up?
Yeah, so I've been on all of those medications plus some. I started therapy in general when I was in high school because of the eating disorder, and I was in treatment for that a couple times, partial inpatient. But after I got diagnosed with BPD was right after I had a really severe episode in which I tried to take my own life. And my family and I were like, all of us agreed, we can't handle this. We got to get some help. And I went to an inpatient in Texas. I was there for 2 months, and then from there I went to a step down in Illinois for 9 months, and then after that I wasn't really in therapy for years, and then in 2017 I experienced a breakup that had me falling all over the place. And that was where I finally found DBT, which is where I think I found the most help. And as far as medication goes, I am unfortunately one of those people that if there is a side effect list of things, I will experience most of those things, and they often don't go away. So most of the medications that I tried didn't really work out for me. I currently only take an anti-seizure medication that works off-label for mood stabilizing and ADHD medication. Those are the only things that I can really stand, which in the long run, I actually think is really positive, because the skills that I learned through DBT have, those are things that I can use no matter how I feel. Although I do also have premenstrual dysphoric disorder. So once a month, it's quite a lot harder to use those skills. But having tried a lot of different things, I mean, milieu therapy was the biggest thing that they used in the group places where I was. And I will say that it has its perks and that you're around other people that struggle, but because it doesn't have a lot of direction, I found that it was very much like high school 2.0, where you get cliques and groups, and there's a lot of self-victimization, and it doesn't always really help people. And I really liked DBT because as far as groups settings are concerned, it's a lot more like class. It's moderated. You don't get into that crosstalk as much.
So for those that don't know what DBT is, can you let us know a little bit more about DBT?
Yeah, so DBT stands for dialectical behavior therapy. It sort of has the synthesis of acceptance and change. So dialectical thought in general is being able to hold two things that appear in opposition as true simultaneously. So, one of the ones for me is like, I feel really hurt by something someone said, and maybe they didn't mean to do it on purpose. So it's being able to hold two things that seem like they may be in opposition as true, which I think for those who really struggle with the extreme thinking, especially for BPD patients, it's incredibly helpful, because it allows us to be able to look at something at a more balanced perspective.
And that is so important. I actually did not do DPT. I can't even talk right now. But I did CPT, which is cognitive behavioral therapy, which was very helpful. And actually during the time I was doing therapy, my mom joined me, which was really good. We did therapy for about 3 months in Mexico. But when I came back to America, it didn't, it got worse again. It got pretty bad. And there came a moment, I had a suicidal moment in Mexico when I was 18. I didn't have one again, but my self-harm got worse. It got a little bit deeper. It got a little bit more dangerous. I lived in an apartment with friends and my then boyfriend, and it just became a moment where everyone was walking on eggshells, made me feel like a monster. You're feeling constant guilt for being who you are, and you're just like, well, this place is just better without me, So even though I wasn't attempting suicide, the suicide thoughts were there constantly. And therapy was something that I, again, tried. Unfortunately, I didn't see the same. I want to say it wasn't as easy in United States. I think it was also because I was not a resident at that time. So it was actually very hard to get any kind of healthcare. And all they gave me was psychiatry and then more medications. Like you, I tend to have a lot of side effects to my medications, and including when I was taking Haldol, which is an antipsychotic, it actually reached hallucinations, which, by the way, when I was a kid, I was like, cool. You know what I mean? When I was like 13 watching Beautiful Mind, I was like, oh, I want to be that guy. And then when you have it, it is the worst thing in the world to not know reality from from not real. It's horrible, absolutely horrible. It only lasted a couple of weeks and then they took me off that medication. But for anyone else that out there listening, medication is not negative nor positive. It depends for every single person. Everybody's different. Everybody's going to react differently to medication. So make sure to not knock it off immediately. Give everything you can a chance. Give different therapies a chance. If one therapy doesn't work, make sure to try different ones. That's very important. So going along with what you were saying, I wanted to talk about a post that you just did, and I absolutely loved it. And if you guys don't follow Xannie on Instagram, make sure to go Instagram and follow at Xannibel, and we have it up here on our dash. It says, and it has you with your hand on your face, and I love it. It says, the size of someone's responses is not equal to their level of caring. That is something I struggled with a lot. If someone didn't respond the way I thought someone should if they cared, I immediately didn't think that they cared. So I brought it up to 11. So maybe they did care, so it's a constant struggle. Tell me a little bit more about that post.
So that post for me is, it's one of those things that I struggle with a lot. And it was one of those where I was kind of nervous about posting it actually, because I think I like to talk a little bit more about the truly dark, unpleasant nature of the mind of having BPD. I always used to think that I was so pure in my responses. Not that I was a pleasant person by any stretch of the imagination, but as if I was purely reactive, right? As if all I ever did was just respond to the world around me, and this was somehow authentic. And it's been a challenge, but a useful one, to realize that I was not as pure as I thought, and to recognize that a lot of my emotions, while real, existed for the sake of manipulating other people into behaving in a way that I thought was how they should. And I think these conversations are hard to have because, if you're emotionally sensitive, admitting truly unpleasant things about yourself, like those dark motivations, the fact that, yes, I sometimes act in a certain way because I'm trying to control other people. Those things are incredibly painful to admit. Those things are really hard to talk about, but we have to talk about them, because if we aren't willing to admit, the cases in which we are narcissistic and controlling and abusive, if we aren't able to look at those things, I don't know how we ever hope to change them. And so that's really what that post is about, is accepting responsibility for the fact that my emotions didn't always come from a purely reactive place. Sometimes they existed to facilitate or elicit a specific response in someone else.
And it's crazy because as hard as it is, it's liberating and it's very important. And it's something that I had a very hard time with too, because I thought of myself as such a great leader, empathetic, but I was trying to elicit certain responses. I was extremely manipulative. I still am, I try to control myself, but absolutely extremely narcissistic. And I lied a lot, because to me, the possibility of it being a reality was just the same as it being a reality, and it wasn't until someone very close to me said, "You lie a lot." And I was like, wait, what? Like, I know I am, but how are you seeing through it? And wait, I can't manipulate you. It took someone very, very close to me, very special to me, for me to realize a lot of those things. And I think he did it in a wonderful, beautiful way, where it wasn't like treating you like a different, or like saying, hey, why are you this way? It was more of like you don't need to do this, and that's when I started accepting a lot of things, and I actually started advocating. I have not been talking about mental illness for very long. It's been just 2020. I lost my grandmother, a lot of changes, the pandemic happened, lost my job. And I was like, you know what? I'm either going to just plummet, or I'm going to really look inside. And I started, going through my education and becoming a coach and leading the way I think I always wanted to lead. But like you said, secretly, you're still kind of doing things for other reasons. And I must say that as many people as I see on the internet and advocating, I really resonated towards you, because you're a very real person, and real takes talking about things that you don't want to talk about, and saying the truths that you don't even want to hear. You say it and you're like, oh man, I can't believe, I do this, or I am this person. So before we keep going, I must say thank you, because we definitely need more people like you advocating, not only for BPD, but for mental health. And I really, from the bottom of my heart, appreciate you being so open about things that are not very easy to talk about. So what do you consider is the best way right now that we could educate people on BPD?
I think it's a challenging question to answer, because there are two sides to dealing with BPD. There's the managing the emotional response, but also experiencing the emotional response. And I think part of the reason why the stigma is bad is because, especially if someone has been in a romantic relationship with someone with BPD, they've probably experienced the brunt of some of the worst symptoms. And it's very hard to come back from that and be willing to look at someone in a dialectic way. And so I think the only way that we can really reduce stigma is to honor that perspective. Because I know for me, for a long time, my response to that was basically to be like, well, you just don't understand me. Like, I'm not trying to be abusive. You don't get to, I'm not manipulative. I'm not toxic. Like, how dare you say that I'm this like terrible person? I have a disorder. You just have to suck it up and deal with it. And I see a lot of posts like that. And I totally understand where that perspective comes from. I'm not judging anyone for being in that headspace. I just think that if we want to get people to be on our side, it's important that we don't treat their experience like it doesn't mean anything. Because even if I'm not intending to be a jerk, if I'm being a jerk, I'm still being a jerk. Mm-hmm. And I think if we can honor the difficulty that dealing on the outside of dealing with what BPD is like, it will make it easier for others to be willing to hear what we as BPD sufferers experience. Because I just think if we invalidate other people's experience by saying, well, you don't get to have an opinion, you don't have the disorder, how can we possibly expect them to want to listen to what we have to say? Because we've basically just told them that their opinion has no value. And exactly. That's a very challenging middle path space to take. But in my opinion, I think that's the only way that we can get everyone to work together, is to be willing to honor everyone's side.
Yes, I totally agree, because we have to be able to, sure, there are things that I have Tourette's too. So sometimes I'll twitch or I'll drop something or something. Clearly, I'm not trying to do that, but I'm still going to apologize. And especially with BPD, if I yelled at you for the last 30 minutes and I said horrible things to you, I'm not just going to brush it off. I'm going to own up to it. And because you're a human being too. And if I have feelings, you have feelings, and I have to, apologize and make it feel better. I have one last question that is really, I don't even know how to ask it, but when we have fits, when we have these moments, which I haven't had in a very long time, and I'm thankful, and I feel like I am doing very well managing my BPD for the last 7 years. But prior to that, my fits were probably once a week. And it would become a thing where you'd wake up and all of a sudden, if I was like, that's it, the day's ruined, everything is shitty around me, it's not going to get any better, that's it. You wouldn't be able to get me out of bed. I was in a bad mood all day. I would be happy 1 minute and then completely upset and just going off the next minute. Everything would make me angry. When we're in the middle of a fit, I remember that the most hurtful thing for me was seeing the person shaken up, crying, freaking out, or yelling back at me. And I find I want to know from your perspective, what can, not advising, but what could the other person do in that moment who's experiencing this? Because as a person who's experiencing it, you don't want them to have you don't want to feel guilty and see how you're hurting them, but they're human beings. So what is your opinion on that?
You mean like what the other person could do to respond in the situation?
Exactly.
Well, I can tell you what my husband does that is helpful for me.
Yes.
This may sound a little counterintuitive, but one of the things that he does that I find extremely helpful is to not take my emotions too seriously. because if he takes my every emotional fit that I have really seriously, then he will get drained and he won't want to deal with me. And sometimes when I'm having a strong emotion about something, I'm not really sure if it's something that warrants that level of emotion. And if other people take it really seriously, then I feel like they're saying, yes, like this totally makes sense. Have this emotion, even if they're telling me verbally, like, you're overreacting, blah, blah, blah. But if they are having an emotion that's at a similar level to mine, that's validating somehow. And especially if I'm having a fit about something that has nothing to do with him, he'll say, I mean, it sounds funny because it sounds like he's talking down to me. He's like, "Oh, are you having a fit? Like, do you need a hug? Okay, it's okay." It's sort of like baby talk. And at least for me, because I know him and I know it doesn't come from a place of like he's belittling me, but it sort of makes me see, okay, like, I'm throwing a fit about the fact that the laundry dyed a sock green. Like, doesn't have to be the end of the world. And it doesn't always hit the mark. Sometimes it is really serious. And if he does something like that, then I'll be like, "Oh, you're not taking it serious enough." But most of the time, that response works really well. And he comes and gives me a hug, and I'm like, he's like, "It's okay." And I'm like, "Okay." Or, a lot of the times I'll be throwing a fit about something and he won't even respond to what I'm throwing a fit about. He will just, tell me that everything's going to be okay, or like, "I love you, everything's fine." Because like he knows that a lot of the concerns that I have are that he's going to abandon me or something like that. And so if I'm not attacking him directly, usually he's able to be pretty clear-headed and go, "You're not being rejected. Everything's going to be okay." And focusing on that instead of whatever thing I'm blowing out of proportion, I find is the most helpful, because there isn't, especially when it's very obvious that I'm blowing something out of proportion, there pretty much isn't anything he can say about that topic that I'm going to receive well, whether it's on my side or not. And so if he just doesn't, just focus on what he knows is underneath, that usually tends to go pretty well.
I love it. That's a great response. And honestly, something that has helped me too. Sometimes I have my fiance is fantastic at just being like, "Oh, the girl doesn't feel good. Like, come here, the girl," and you never, as a teenager, I think I would have gone nuts. I would have been like, "What?" But it actually feels so nice to feel that love and that level of pampering. And it really helps. And if you are in that position, like Xannie said, sometimes it's really important to not continue the conversation because we are blowing something out of proportion. So it's just better to let the person know that everything is going to be okay, because sometimes I know I didn't really know that it was. As hard as it is to believe, you really don't think it's going to be okay. You think it's just a never-ending story. So that is very important. I want to tell people out there, if they're listening or watching, we're going to have a link up for the National Alliance on Mental Illness, which is www.nami.org. Go ahead and take the stigma quiz, because sometimes we don't even know if we are being that person with certain stigmas until we answer some questions and go, "Oh yeah, I think I am being a little like that." And after you take the quiz, if this is something that you believe in, go ahead and take the pledge to be stigma-free. I think that it's very important. In Xannie's case, when she was feeling these things when she was 15, I was feeling this around that same age too, 13, 12. It's really difficult to have support in school, at home, even, because it's not that your parents don't want to support you. My parents are wonderfully supportive, but they didn't know what to do. It was something new to them. No one in my family and my mother's side has any mental illness. It was my dad's side, and he doesn't live with us. So again, it's really important that we support our society and our community. If you're a teacher, watch out for your students. If you're a parent, watch out for your child. Make sure that as a community, we all live stigma-free, and that mental health, we make it attainable, sustainable, and affordable for everybody, because mental health is very, very important. Xannie, is there anything you want to share with us, if anything that you want to plug in before we finish up here?
Nope. I think I said pretty much everything I want to say. I guess the only other thing I would say is that, it's that trying to get rid of that stigma is really important, especially for teenagers. We were talking earlier about the challenge of diagnosing teens, and I get why it's hard to tell the difference between what's puberty and what's not. And it's important that we don't pigeonhole our young people by, saying, oh, for sure you have this thing. And it's also important not to say, oh, well, you're just a teenager, so, we'll talk again when you're 18, and that it's important that you keep an open mind in dealing with people going through these things. And that's the only way that we'll be able to move forwards.
Open mind. We're all different. I've said it before. I don't think of my problems as problems. I see them sometimes as superpowers because they still made us the person that we are. You're an incredibly creative person. You're so well-spoken. You're so intelligent. And I think that sometimes because we've had to deal with these kinds of roadblocks along the way, it has made us stronger and we find creative ways to work through them. So congratulations on being the human being that you are. Thank you so much, Xannie, for being a true badass. I don't think this will be the last time I speak to you, and it won't be the last time we have you on this podcast. Like I said, BPD was the most downloaded episode, so I definitely want to keep talking about this and maybe diving into certain areas of BPD. Thank you so much, guys. Make sure to follow Xannie. Go to her Instagram. She's a wonderful advocate. Thank you so much for your time, Xannie. And thank you so much for everybody out there watching. Wellness is so important. Mental health is so important. And if you feel like anything in this podcast resonates with you, you can always contact us. Drop a comment below, follow, contact me. I'm available for you guys. Let me know what you're thinking. Let me know if you have any questions. And again, this isn't medical advice. If you do feel the need that you need help, please go with your primary physician and medical staff, okay? Thank you guys so much. We will see you next time on another episode of the Wellness of Madness podcast. Have a great day, everybody.